We will go back to Sweden now and to Gothenburg and talk to a gentleman here who has actually gone through from ID to actually scaling. First from our innovation support program that we have to our incubator and now also from the accelerator side. So welcome Daniel and a big hands for CareLogic.
Thank you. So hello everybody. The image to the right is an emergency bag used by paramedics. The second row contains controlled drugs. Controlled drugs are substances that are regulated by law due to the risk of abuse. So we just launched LogMed. It's a digital platform that makes controlled drug management more secure and more efficient. So controlled drugs are typically managed in a non-digital environment. In Sweden, we have approximately 1,400 SKUs where regulations are met by registering and signing stock transactions on paper. This is done in around 33,000 store locations and handled by 114,000 users. So the problem is multi-dimensional. First, there are loads of inventory discrepancies due to mistakes and theft. This year, Sahlgrenska University Hospital alone have identified almost 200 incidents of controlled drugs inventory shrinkage that needs to be further investigated. Second point, compliant fieldwork and incident investigations are time-consuming. It can take days to backtrack one single incident. And thirdly, audit findings that do require manual actions are not uncommon. So this all leads to an increased workload on already overburdened staff, potentially contributing to burnout and definitely leading to operational inefficiency. Having a system that lacks in control can lead to, can trigger drug addiction and maintain it, leading to immense personal tragedies. And the combination of inventory discrepancies with staff that are addicted will further increase patient risks. So there is a definite need for a system that can provide better control in more secure and efficient ways. So we decided to act upon this and we developed LogMed. It consists of two parts, a native app for fieldwork where nurses will register stock transactions and inventory takings. And then we have a web application for management where they will do admin configuration, have access to traceability reports, real-time incident notifications, as well as replenishment suggestions to simplify inventory management. So we launched our MVP end of summer, and we are in positive dialogue with 4 health regions in Sweden, 1 municipality and 1 animal hospital. We have ongoing trials at the elderly care facility and at the primary care unit. And we are right now in the process of onboarding our first paying customer. It's an ambulance organization with 240 users. We have a subscription-based revenue model where the caregiver pays a base price for the installation, and then we have fees for premium and basic services depending on the number of users and storage locations. We assess the obtainable market in Sweden to be about 4 million euros. This is based on a 6% market penetration into the available market. Many countries have the same requirements or needs as Sweden. For example, all of the Nordics, where we do believe we can get annual recurring revenues of 10 million euros. Andreas and I, as co-founders, have the relevant expertise from healthcare systems development, system implementations, supply chain, and software sales. We have complemented the team with a full-stack developer, Sia, and with Jonathan focusing on customer success. So what we ask for today is an investment of 200,000 euros. This will be invested in marketing and sales, implementations and support, and product development, and it will give us a positive cash flow within 2 years. Thank you very much. I look forward to working with you. Okay.
Thank you. So, who would like to start here? And I know, Jörn, you arrived a little bit late here and joined the panel, so maybe just a quick introduction to who you are, so that the audience knows.
Yeah, Jörn, investor, founder. I'm enthusiastic about tech, I guess. That's my background. And one thing I often talk about with founders is the serviceable market that you talk about. You indicate 6% here. I would rather want to know what kind of market you can take 30% of, 40% of.
Yeah.
Like to go even further to the core of this thing. Not, who's this going to be nice for, but who is desperately in need of and will buy whatever crappy level product you have right now, expecting that it will be better later, but still accepting the unrefined qualities of a startup.
Yeah.
What's that customer?
Yeah. So if we sub-segment the healthcare sector, pre-hospital market is a big one. That's where we experience a pull right now, and there we expect in the Swedish market to capture 70 to 90% within the next few years. And that will be similar for the Nordics. And then next year we will do a global expansion strategy to see what that means for India, US, rest of Europe, and so on.
All right, next up, Valerie.
Thank you. I never thought that it is a problem. This is like the first time. How do you handle the regulatory compliance, data security, and all that?
So data security is not really an issue. It's GDPR, and it's either staff data or patient data. We don't need any MDR compliance for this. So I would say regular GDPR work. Yeah.
All right.
Quickly and related to that, I think when you don't have control of inventory, you have a financial loss, but there might be some regulatory requirements that you don't meet, so you might lose your license. So it's of critical, operational nature what you're actually addressing. Is that the case?
Well, the regulations is by law. It's Socialstyrelsen in Sweden. And we don't see any big fines for non-compliance, unfortunately. If we could fix that, that would be great. Okay. Yeah.
I have more of a commercial question.
Yes.
How do you know that the business model that you're currently using is the best one?
We don't.
Have you considered any other?
We have. Right now we've tested this and we have, where we're doing the trials, we have upfront told them what it will cost, and they have swallowed the bait. The ambulance organization, when we first came to them, they said we want a 6-month trial. When we left, they said we want to start next year. Last week they came back and said we want to start in December. So empirically, we have a revenue model that works. But we're open for other ideas as well, of course. Maybe we're taking too little revenue since they're so eager.
Because is your inkling that you're a little bit either too eager to pay, or is your pricing too generous, or could you increase the pricing?
Could be.
Is there more of an appetite there?
Could be. We will do some A and B testing.
Interesting.
And see what happens.
Yeah, you two could discuss this a little bit more later.
It could also be interesting for insurance. One case, if a region has to send someone to rehab, it will cost them easily 15,000 euros. So,
All right. Thank you, Daniel.
Thank you.
And yeah.